Joining us this morning is Gail Castrilla and Renee Klaric, and they are with Signature Health. Okay. Are you a director?
No, I'm Renee.
You're the director. You've been on the show before.
Yes, for Geauga Hospital.
Yeah, right.
A medical stabilization program I set up with Dr. Brown.
Oh, wow. That was a while back, wasn't it? Yeah. We wanted to have you girls on to talk about Signature Health, which, is it located where the old theater was?
No, it's the old Hotel Ashtabula.
The old Hotel Ashtabula. And this is a picture of it.
Yes, that's the lobby.
Wow. That is beautiful.
The building's on the National Historic Landmark list.
Is it really? Tell us, can you tell us, Gail, a little history about this?
About the building?
Yeah, and also the Signature Health, what you guys do.
Okay. Well, Signature Health is a comprehensive community mental health agency that provides a wide variety of services that we'll probably have the opportunity to mention specifically as we go along.
Okay.
We've been in Ashtabula for about 14 or 15 years now and moved into the hotel last June. So while we began very small with Sue Krieg as the first office director, you know Susan,
Yeah,
Susan
very well.
Kennedy. She did a great job of bringing the services to life here in Ashtabula County. The office originally began in Willoughby and still provides services to Lake County residents from a Willoughby office. Also is in Cuyahoga County in Garfield Heights. But the Ashtabula office, as I said, has been here about 14 or 15 years.
How long have you worked there?
I think this is my 12th or 13th year.
Is it really? Really? Renee, what are some of the services that you actually provide for people out there?
Well, Signature Health wants to be a comprehensive service agency, which means we provide mental health and physical health. We have a pharmacy, we have a primary medicine.
Really?
Yes, primary medicine physicians. We have a blood draw lab. We have psychiatry. We have all kinds of IOPs for drug treatment. We do Vivitrol. We do Suboxone treatment. We have child psychiatry. We do group therapy, tons of group therapy. We do a lot, anger management, bereavement groups. We do 3 IOPs a day. We do integrated medicine. Recently we've added the CAC, which is the Child Advocacy Center, and traditionally when children would report being molested or raped, they would have to then go to Children's Services and they'd have to report it again and again until they get the story. With the Child Advocacy Center, they come to our office. They have a place for all the attorneys and the child center people, and they get a chance to tell their story one time, and it's written down to disc. They ask questions, and the child only has to be interviewed one time.
Okay, that's important.
Yes, that's up and running today.
Yeah, that's great. That's great. I didn't realize that you had all these services there.
We also have a men's group home.
You do?
That we service. Yes, a type 1 residential group home for mental health.
Oh.
16. It has 16 beds.
I'm surprised that I'm not was not that familiar with this particular program. It sounds really, really helpful for the county in general. So you cover the whole county then, and anybody can go there from Ashtabula County, is that?
Or any county, because it's a Medicaid service. They could come from any county.
Really?
Treatment.
Okay, that's cool. I see Matt is here.
Oh, good.
Oh, great.
And what we need to do, we'll step aside for just a second. We'll set up Matt, and because he's the one that set up this interview, actually. We'll set up Matt. We'll be right back right after this. Matt Crawford joining us now. Matt, tell us your impressions of Signature Health.
Oh, I love them. I've been with Signature Health for 11 years now.
Really?
Yeah. I started with Gail as my therapist, actually.
Really?
Yeah. And then I went on to see their psychiatrist. I'm bipolar. I've said that before. You know, and I suffer real bad depression. And so I've been with them for 11 years, and they're the best. I got the best care.
Been helpful.
Yeah.
Very
oh,
helpful for you.
Yeah. I'm functional now. I wasn't functional.
Really?
Yeah, no. I was, no, I wasn't.
Hmm.
You know, because I was constantly depressed. I was constantly on a stage, it seemed like. You know, you're trying
Well, you know what do you think caused all that?
chemical imbalance in the brain.
Is that
I
what
think
it-
you're born with it.
Really?
Yeah. You know, and I'm on medications to adjust I don't know how they work, but they adjust your chemicals to,
So you would go there and have treatments and
Mhm.
you know, I'll be darned.
Yeah.
Okay.
yeah.
I was amazed that when Gail showed me the picture of this facility, it's absolutely beautiful.
Oh, it's gorgeous inside.
Yeah, I'd never been there, and I told Gail and Renee that I was not really familiar with all this. And I'm so glad that they came in to
Yeah.
explain it. You
It was
know.
what, a $5 million investment in the building, I believe.
Is it?
Yeah.
Wow.
Yeah, 4.1 is
Oh.
what I have. I brought a few notes about the hotel because most people are very curious about it.
Mhm.
I think anyone local is fascinated. They remember going there for their prom or
Sure.
their wedding reception, meetings, parties, and they have a real fondness to it. People
I used to
show
go there
up-
all the time when
Yeah.
we were younger. You know,
Really?
we'd go there
Yeah.
and have dinner and stuff, and it was the place to go.
There
Yeah.
were a lot of great stories when they were in the process of the renovation. People would kind of wander in off the street and poke their head in and tell a story about, you know, I was a bellboy here, you know, 7 years
What
ago.
actually happened to it, Gail? I mean, did it just close, or I don't remember, to be honest with you.
Yeah, it was scaled down. There was still a reception hall, the ballroom, and we still call it the ballroom, and two restaurants in it for a number of years. And then there was a small bar up front.
Yeah,
It
yeah.
just kind of kept, you know, and then eventually was vacant for many years and fell into a terrible disrepair.
Did it?
If anybody questions that these old buildings can be brought back, they should visit Signature Health because it's absolutely beautiful. It's
Yeah.
amazing what it looked like before we began and what Chuck
Yeah,
Borsikoff
it was
doing.
closed for a long,
A
long time.
Yeah.
And but so I must be dating myself here, but it had to be back into the early '70s. We used to go there for dinner,
Yeah.
and we had parties there
Yeah.
and stuff.
I think that when we had our open house and served food to our guests, Jonathan Lee, the president and CEO of Signature Health, said that that was the first meal served there in 40 years or something like that. So-
No, that'd be about right.
Yeah.
That would be about right, because it was probably early to mid '70s when I remember last being there. And then I kind of lost, because I don't live there, obviously.
Mm-hmm.
I lost track of it. My wife works there across the street, so she probably knows more history
Mm-hmm. Yeah.
about it than I do. But that's fascinating to me. It really is. You know, Renee's been on the show before.
Oh, really?
Yeah, she was
Oh,
on
cool.
the show before. She was with Giaga
Yeah.
and came in and we did an interview. And she looked familiar when she came in.
Yeah.
It having to do with the heroin epidemic. They started the medical stabilization at like
Yep.
Jaga Hospital.
Yeah. Now we mentioned some services, and I know it's probably pretty hard to remember all of them
Oh yeah.
that you offer.
Read down a list.
And yeah, I got the same thing you got there. Marriage and family counseling, very important. And do you have any idea how many people you serve? I mean,
I think it's close to 3,000.
is it really?
As far as open cases.
Okay.
The total between the three offices is 12,367 for last year in 2014. We print an annual report each year, and it usually comes out in March of the following year, and it offers a lot of information about what's happening with Signature Health. If anybody wants a copy, let me know, and I'll be glad to drop it in the mail to them.
All public record and that stuff. Can you tell us your hours that you're open, what, 5 days a week?
5 days a week. Usually the doors open at about 7:30, and we close at 8 o'clock at night, and Fridays we close at 5. We have a walk-in assessment clinic, so no appointments needed. They can walk in from 9 to 2 every day as far as getting a walk-in assessment.
How many people do you employ?
About 100, at our office, about 115.
No kidding.
Yeah,
That's
it's
something.
huge.
We
I
have
mean, this
case
is the best.
management and counseling.
Yeah.
You could speak to that.
Yeah, I see it. She won't mind if I use her name, I'm sure. Kathy Babowski.
Huh?
I see Kathy as
She's
my
from Connie,
therapist
yeah.
now.
Kathy,
yeah.
Yeah, she's my therapist. I have a Dr. El Sayed, who is my psychiatrist, and she knows drug interactions, and because I do a lot of heart meds also because of my pacemaker and my bad heart, and she knew the interactions right off the bat. You know, well, we can't put you on this, but we can put you on this at this.
Really?
level. Yeah. I mean, she's the best. You know, and then I have a caseworker, Tracy Picard. You know, so I'm covered. Anything I need, I got 3 phone calls I can make. You know, and Dr. LCA, all the psychiatrists have their own nurses. You know, and I can call Mahalia and say, hey, you know, I'm really having a problem. I got to get in and see Doc as soon as possible. And I'm usually in within the next day or 2.
What if something happens, Matt, over the weekend or something? You're having a bad day. Can you call, and do they have caseworkers that would help you there?
They have a crisis line.
Okay.
There is a crisis line you can call. I don't know the number off the top of my head, unfortunately, but I have it at home. Or just go to your nearest emergency room.
Okay.
You know,
Okay.
that's always, you know, that's always an option. Because the doctors at Signature Health, the psychiatry unit for Ashtabula County is in ACMC. And the doctors at Signature Health, some of them work at ACMC also, you know, in the psychiatric unit, and they're, you know, they're meshed in. You know, one doctor knows exactly what the other one's doing. They don't, you know, they don't do anything without conferring with your doctor.
Right.
So that's just the easy, you know, fallback is just go
Sure.
to, and they'll get, you know, even if you're from Conneaut, go to your Conneaut emergency room and they'll get you to ACMC. You know, they'll have the squad come and get you and they'll take you down.
You know, I went to school with Kathy Connors Babalski,
Oh, really?
and she was such a beautiful, probably still is a
Yes,
beautiful
yes,
woman.
very.
She's a
Yeah.
beautiful girl.
Inside and out.
Yeah, just a nice,
Yeah,
nice
she's
person.
very caring.
And Tracy Picard is a local girl as
Yes,
well.
she is. Yeah,
Is she?
yeah,
Yeah.
yeah.
You know, so what got me mad, like this all started because I got mad. Can I go into this for a
If
second?
you want.
Was you received a phone call that was very derogatory towards Signature Health,
Right.
and I feel they saved my life more than once.
Mm-hmm.
You know, because when I get depressed, I get suicidal depressed.
Mm-hmm.
You know, that's not a secret. And to badmouth Signature Health just really infuriated me. I mean, I got really mad.
Yeah, I think the caller, who was Dennis, by the way, was saying that he was sitting in the parking lot and saw a bunch of
Drug addicts,
drug addicts,
meth heads,
yeah,
coke heads. I mean, he
yeah.
called them every, you know, and I can, you know, any one of us could be you know, have a problem.
Mm-hmm.
You know, and mental illness doesn't necessarily go hand in hand with drug addiction.
And if they're going there to help themselves, you know, why are you cutting them down? Is
Yeah.
I think what your point was.
Yeah.
You know,
That's the place they should be.
that's where they
Right,
should
that's where
be.
they should be.
That's
Exactly.
where
Yeah.
we want them.
Exactly. And they were trying to help themselves, so he shouldn't have categorized them that
Right,
way.
right.
You know, so.
A lot of it is misconception about addiction.
And
Not-
how do you mean?
Not understanding the chronic nature of addiction, that it is a chronic disease, and when people look at addiction, they're like, oh, why don't they just stop using? And I always say, well, why don't we all weigh what we want to weigh, eat what
Yeah.
we should eat? And it's that hard.
Mhm.
It's that hard. Where I could take a drug and it will nauseate me, like an opiate, but somebody who has an addictive brain, just like somebody, you have a mental illness, you couldn't help that. You
Mhm.
can't
Right.
help whether you have an addictive brain, and they take an opiate and their brain lights up and they said, this is the best thing that ever happened to me. And
Yeah.
I might take it and say, oh, I'm so nauseated.
Right.
It doesn't get along. So when they do that, that triggers in an addiction, and they need to work on their addiction just like any chronic illness. It's
Sure.
a chronic illness.
Yeah, yeah. We've been covering that here on the show. Matt would probably tell you that we're trying to get the word out. As a matter of fact, the subject matter last week was with a doctor that was talking about marijuana, and the bottom line to his segment was, it's not good for you. You know, you're adjusting your mind with a drug that's not even legal here. You know, and so he had a very nice segment on it, and he addressed it because they're talking about legalizing it and stuff. And he says, we're just opening a can of worms by doing that.
By all means.
Mm-hmm.
Marijuana is very insidious in that when people are high, years ago they did I think we talked about this before, they had airline pilots and they had them smoke 4% THC way back in the 70s.
Mm-hmm.
And they got in, of course, they got in their flight simulator and they crashed their plane because they were high. The surprising part is 24 hours later, they were still impaired. When
Really?
they crashed the plane. Now that's on 4% THC. We're running 28, 30 with the new types of crystallized, homegrown.
Mm-hmm.
And the problem with it, it lays in your fat cells and it leaches out over a lower period of time. So the layer of impairment is every time you smoke, it hasn't leached out.
Mm-hmm.
So you can not be high, but you can be really impaired, and it affects work. It affects what you do.
Yeah. And isn't it in your bloodstream for a considerable amount of time, 10 days or more?
Well, it depends how much you smoke, the intensity, and really your body mass index. If it lays in the brain, because that's a fat cell, it lays in the sexual organs and in the body fat, and then it just stays there until it leaches out over a very slow period of time. And that's why there's no withdrawal from it, because it's a slow leaching. There is a withdrawal, it's just an extremely slow process.
Really?
Yeah.
Never knew any of that
It's like
stuff.
heroin, when it's a quick withdrawal, and so when you go into withdrawal, you get very sick. But with marijuana, it's very, very slow.
I'm going to ask you, I've had the sheriff on and other law enforcement officials on, and they have said that the heroin usage in Ashtabula County is extremely high. Do you see a lot of that in your...
It's not only here, it's throughout.
It's everywhere.
It's everywhere.
Because it's supposedly cheaper now to get.
Well, in fact, they're having the opiate summit down in Columbus right now.
Are they?
Yeah, with the heads of all the providers. It is cheap. It's prescription drugs are cheap. You know, people say, I get all my prescription drugs. They say that I sell it on the street. You can buy heroin cheaper than you could buy a Percocet, though.
Really?
Yes, and that's the problem when the kids or whoever gets hooked on the prescribed medication, then there is no more prescription. They have to go somewhere to keep the opiates in their system, so they go to a cheaper form of heroin. Where we used to, growing up, you'd think, oh, heroin's a very expensive drug. Now,
Right.
Now it's a very cheap high.
See, I never knew that until the sheriff told me that. And because, you know, you see the movies back in the 50s and 60s about heroin. That was the taboo drug of all time. And now it's kind of commonplace. It's scary. It's very scary. Basically, this facility is a big addition to downtown Ashtabula. It probably adds a lot. I'll turn that back over to you, Matt.
Okay, on a daily basis, there's probably close to 100 employees working at the building, you know, because you're going from 7:30 in the morning till 8 at night, so you have a lot of turnover, you know. Those people are eating downtown, they're buying their meals downtown, they're, you know, getting their gas downtown, because they don't all live locally, you know. And a lot of the clientele are utilizing the cabs. I see North Coast ambulettes. They bring people in all the time.
Sure.
Axe Bus brings people in all the time. There's just so much positive that the facility, by bringing it from 3 buildings scattered into the one, you know, the positive impact that it made on the community, that, you know, that needs to be recognized, I believe. You know.
We're a member of the Ashtabula Downtown Development Association and active with that organization,
Okay.
And have been for a number of years in an effort to reach out to those neighbors and an effort to be a good neighbor to them. share information about who we are and what we're doing, because there is some curiosity, and I think at some point we should talk some more about the stigma that's associated.
Sure.
Yeah.
But we're involved in a lot of the good things that happen downtown, make every effort to be a good neighbor, and are proud of that. We, and correct me if I'm wrong, but my understanding is that we signed a long-term lease for the building, which was what allowed the developers to go ahead and do what they had hoped to do, I think, for a lot of years. So that commitment we made is long-term to staying in Ashtabula.
Yeah.
And worked with a lot of, worked very closely with city officials, county and state. It was, again, a historic building, so there was lots of cooperation and collaboration.
You need that to make things successful.
Yes.
You know. You mentioned the stigma. I want to turn that over to you too, Gail. Can you talk about a little bit about that?
Well, a simple example that I use a lot is our medical or physical health versus our mental health, and we try to separate that, which is nonsense, because this is all one unit here. But if we have a cough and we're sneezing and our throat is sore, we identify those as symptoms, and that tells me I've probably got a cold, and I know what I need to do for self-care so that I feel better in a week or 10 days. If I'm really sad, if I don't enjoy the things I used to, if I'm withdrawing from family and friends, those are symptoms of emotional or mental problems that would indicate that I may be feeling depressed. And there may be some things I can do for self-care. Watch a funny movie, kind of force myself to get out with friends, do some things.
Right.
But at some point, if we're back at the physical health example, that cough doesn't go away, it's gone on for weeks, I'm really feeling poorly, it's interfering with my functioning. I'm calling off work, I can't do a very good job of taking care of my other responsibilities, so I need to go see a professional and get some help. And the same with our mental or emotional health, is that depression doesn't pass. It's gone on for weeks. It's beginning to impair my functioning. I can't do the things that I need to do. I don't feel like getting out of bed and making dinner for my children or whatever. So it's so strange to me that we don't blame anybody for having symptoms of a cold. We don't feel that person should be embarrassed or ashamed or hide those things. But what do we do to the person who's suffering emotionally or mentally? And suffering is the right word. And we make it difficult for people to get the help that they need. We make them feel embarrassed, uncomfortable. And, unfortunately, I think your caller that had the concerns about Signature Health, may be an example of that stigma.
Yeah.
And so
Exactly.
we really work hard to fight that. I do a lot of these kinds of presentations where I try to convince people that it's okay to talk about your mental and emotional health and to take care of it.
That's what I give Matt 150% credit.
Yeah.
To come on the air, and he's done it more than once, and explain what he has gone through. And he does it to help other people, to let them know that it's okay to say, I've had a little problem here, it needs fixed, and I went about and got it fixed. And I've had people comment about Matt's appearances and his phone calls where he has explained all this, and they're just amazed at his candid remarks and the ability to be able to speak about it. I think it's very good that he does that.
I'm gonna come clean. I can't believe I'm doing this. But we're talking about the stigma. Last Wednesday, I went to Signature Health. I had called on Tuesday because I was having really depressed. I mean, I was really, really depressed, suicidal depressed, and I was lashing out on Facebook to people. I don't know if you noticed.
A little bit.
Yeah, that was kind of nasty. Because I wasn't myself. I needed an adjustment.
Yeah.
Not an attitude adjustment, I just needed a chemical adjustment. So I called Mahalia and I talked to her, and she got me in to see Dr. El Sayed the very next day, early. And I ended up going out the back door and walking into an ambulance. and they took me to the psychiatric unit.
Really?
Yeah, at ACMC. And I put on Facebook that I had heart problems.
Right,
I was
right.
in the hospital because of heart problems, because of that stigma. You know, but to my friends I told, you know, yeah, I was in the psychiatric and I needed a balance. And the care that I had there, my doctor up there turned out to be the husband of Dr. El Sayed, you know.
Is that right?
Yeah, my psychiatrist, you know. And I said, you know, I didn't know this, you know. And I
Right.
told him, I said, oh, you know, my doctor's going to become your colleague. You know, he goes, well, she's more than my colleague, she's my wife.
Oh,
you know?
for goodness
I was
sake.
like, you're kidding me. I knew she was married, but I didn't know who. you
Yeah,
know?
right,
He
right.
goes, she's more than my colleague, she's my wife for the last 6 years. You
I'll
know?
be
I
damned.
was like, oh man, you know, that's perfect. you
Yeah.
know? So I know I got the best of care, you know,
Right.
And
from both of
communication
them.
is,
Yeah, you know they were talking, you know,
Yeah.
this is what I needed. But I went in and they did a medical medicine adjustment, and I got out 5 days later,
And
you
feel
know,
okay.
and I feel fantastic.
Yeah, yeah.
You know, I feel fantastic.
I'll be darned.
Looking forward to coming on to the show. I'm looking
Yeah.
forward to, you know, I have other appointments coming up that I'm looking forward to
Sure.
going. And I wasn't looking forward to any of this stuff. You
Wow.
know, it was a chore. I went to meetings, you know, I had meetings when I was depressed, and I had appointments that I had to be at, you know, filming this and filming that. And it was a chore to get there. And I was on stage, you know, oh, look at me, I'm so happy and everything's fine. You know, but it wasn't.
Yeah.
You know, I wanted to grab a handful of pills and take them all and just check out.
Well, I kind of got the impression that there might be something other than a heart problem.
Yeah.
But I've known you a long time.
Yeah,
so.
yeah.
But I'm glad that you got that taken care of. And it's good that you do.
Yeah.
Like Gail said, you don't want to just suffer with this.
Oh, it was terrible.
And it's not going to go away on its own.
No, it don't
you
go
know?
away on its own.
And I guess if to stay with this theme a little bit longer and talk about chemical dependency,
Mm-hmm.
because I think, again, per your caller, there's a real stigma attached to that. But substance use, abuse, chemical dependency, whatever label we want to put on it, technically is a mental health disorder.
Mm-hmm.
You know, and people suffer from addiction.
Right. Right. Way too much. I mean,
Getting help, talking about it, feeling safe to go to someone
Mm-hmm.
and say I need help. You know, and that's why the walk-in assessment center. You know, sometimes it's really hard to pull it together and call and schedule an appointment that's 2 weeks out and then get yourself there. When today's the day you've decided I'm ready, and now you can just walk in the doors.
that's good. Yeah.
You know, and that was the hardest walk I had to make, was from my doctor's office to the ambulance. You know, I hated that walk because you know, you got that stigma, you know, even of yourself.
Right.
You know, you got this stigma that, you know, I'm so crazy, I'm so, you know, I can't handle life on my own terms, you know, and I got to go get help. You know, it's a weakness. It's a, you know, and that was very hard, you know, but yet I called my nurse yesterday and I thanked her because her and Castrilla sort of, you know, Mahalia said, you weren't going home.
Really?
Yeah, she told me flat out, she goes, you weren't going home, you know, you were going. And, you know, it was kind of funny, but I don't know if they can force you to go to the hospital, you know, if you're a danger to yourself or to others, you know, but I know I walked down there voluntarily. And that was, the stigma was still in my head, you know. I knew I needed the help. I knew I needed a balance adjustment, but I was afraid to go admit this weakness,
Right.
you
Right.
know, and put myself in.
Is it? Would he have had to go if they said you can't go home? Would he have had to go?
There's something we do called pink slipping.
And what's that mean?
Well, when you sign a
It's on a
pink
pink
slip,
slip.
Oh.
it's literally on a pink slip where you're saying he's involuntarily going, and that's per their doctor or someone that would pink
Okay.
slip them. That happens quite a bit.
Does it?
Because at times we can't recognize ourselves. We can't recognize the condition we're in.
Right.
And it takes someone outside ourselves to say, hey, I think you need a little bit more help than than you're thinking right now.
What about the people that are out there that do this this drug addiction thing and don't really want help? I mean, I'm sure there's a lot of that out there. They just want to live that lifestyle day to day to day to day, and it's, you know, starts in the morning and ends up when they pass out at night. I mean, is there a way to beat that, or?
If you look at it in just simple terms, there's a couple thinking, I don't say thinking disorders, but you can call them that in a way. A lot of people think I can use drugs and be a good parent. I can use drugs and have a job and be a good employee. I can use drugs. And the answer is no, that rule is not true.
That's denial type.
Yes.
Yeah.
But they think the rules don't apply to me. But the rules do apply. If you use illicit drugs, you're going to end up in jail. You're going to end up dead eventually because it's going to take over your life because it's your first love. But when someone gets sick of, they always say, I'm sick and tired of being sick and tired, the old AA saying,
Right.
then they say, I'm done and I want help. But you can intervene and you can educate them, and sometimes that light bulb does come on and someone says, you know, I don't want this anymore. But it's no different. We talk about relapse, and we talk about relapse with chronic illnesses. And some of the statistics are relapse rates with chronic disease. With drugs and alcohol, it's 40 to 60% relapse. With diabetes, it's 30 to 50% relapse rate. Hypertension is 50 to 70%, and asthma is 50 to 70%. So really, addiction has a less of a relapse rate than some of the other
It's amazing.
treatments. And it's all in our control to stop and to get the help we need. And of course, as you recognize that, if you don't reach out for the help,
Right.
there's nothing that's going to change.
Yeah.
What are you going to do different?
Renee, maybe you could tell us a little bit about the crisis services that you offer there.
Signature Health has the crisis contract for Ashtabula County. And if somebody, as we were talking about, if someone shows up at the hospital and they don't have insurance, they call us out to disposition with the hospitals, whether they need to go to the state hospital because the hospital couldn't absorb the cost of the person without insurance. So coming into our office, that crisis is 24 hours, 7 days a week. So anybody can call the crisis center. We also go through the Hope Line. We roll over to the Hope Line in the evening so they could get help there. Walk-in crisis, we get walk-in crises quite a bit in our office, and then we have, as you know, 115 employees, but many of those are doctors and nurses. So there's always someone available, and our crisis team also is our walk-in intake assessors. So they're ready to intervene in a crisis when somebody comes in the walk-in clinic.
Gotcha. So, like, you know, using your service, you obviously have to have insurance to cover that.
Medicaid.
Medicaid would do it. Any other insurances or?
We're primarily Medicaid.
Okay.
But
Medicare and workers'
Medicare and
comp,
Medicaid.
government insurances.
Okay. Okay. So, like, I am on Medicare now. I just got on it. So if I had to go there,
You would be covered.
it would be covered.
Yeah.
Okay. Because a lot of things it doesn't. I mean, I have to read the fine print and stuff.
The three
know,
things
man.
I realize Medicare doesn't cover the three things that you need, the teeth, the eyes,
Yeah,
the ears.
isn't it amazing?
Yeah, we had a gentleman walk in, he was on Medicare, and he said he needed hearing aids. And I'm thinking, well, Medicare should cover that, so it's one of the basic things, and no, and it was $500 he needed for his hearing
I
aids.
did read something the other day. I got something in the mail. It said that they do cover 20% of your eyeglasses. Well, eyeglasses cost $400, so it's not a whole bunch. But, they're trying, I guess. Gail, you were going to say something.
Well, I was going to add that we do have patients or clients that come to us and privately pay. In
Okay.
other words, you know, they choose Signature Health, and even if they aren't covered under one of those government insurances, they want to come there. And so perhaps they have a private insurance,
It's on sliding.
and they can come to us. We give them a 20% discount. They pay up front, they have their appointment. We give them all the paperwork they need to submit to their insurance provider. So, you know, there are some other folks that
Now, how does that
choose to
work?
use this.
Like, say if I had to go there, do they pay by the hour of their therapy, or, you know, I mean, or is it a flat fee? I don't know how that works.
Do you wanna-
Let me walk you through the process. Say you want to come to Signature
Okay.
Health. You're feeling down, or you come into Signature Health for a walk-in assessment. The intake department takes all your information and verifies your insurance, your Medicare, your Medicaid. And after that process, you go to an assessor who's assessing your needs, your primary health needs, your mental health needs, and then they work as routers, and they say, okay, we're going to refer you to this doctor, this program. These are the needs that we're perceiving that you are asking for. And so you would then make appointments for your primary care physician there, or to get lab work done after you're done with him, or for a counselor or psychiatric care.
Gotcha.
And you could be set up for group work. Say you had a loss, they set you up with a bereavement group. That way you can be a part of all that at one instance through intake. And with the Medicaid and Medicare, you never see a bill. It's just run right through.
Really?
Yeah.
Okay. Now, what if I want to go there and don't want to use, say I don't have insurance, or going to pay up front? Is that per session that you have to go
Yes,
to?
and that would also depend on your condition, because there's some people that they put on grant through the county who have nothing.
Mm-hmm.
And then they go on grant until we get them on a Medicaid provision.
I got you. Okay.
But yeah, that everything's based on a per service fee.
Did you say that, and maybe I misunderstood, do you have a pharmacy there?
Yes,
So it's a one-stop place,
it's a
really?
one-stop shop.
Wow.
And eventually we'll add, they'd like to add dental health, because most people who aren't taking care of themselves mentally aren't taking care of themselves physically.
Mhm.
So they could walk in there and get completely integrated care, see their primary medicine doctor, see their dentist, get their prescriptions there, get their counseling care, get their group work there.
I see. I see.
That's the whole idea between Signature Health. And Jonathan Lee, you could tell the way he cares about people when you look at that building.
Mm-hmm.
And he says, I'm going to invest in people, and I'm going to invest in the community. And that's what really drew me to Signature Health, was John, and
Really?
his mission and his goal.
Okay. I don't know Jonathan Lee. Is he a local man, or does he live around here?
He lives in Chardon.
Does he?
And is in the Ashtabula office a couple of days a week.
Is he really?
We could arrange a
Yes,
meeting
we
if
could
you'd
have
like to
him
meet
here.
him.
Yeah, that'd be
he's
great.
He has a wonderful
really,
story.
Yeah, he has a very compelling personal story, his own life experiences that kind of led him to this work. He's very charismatic, he's very committed, he works hard to do the right thing.
I'd love to have
help
him
the
on.
community.
That would be
Yeah,
interesting.
yeah,
Be really
he's a really
interesting.
interesting guy.
Yeah. I had another question for you. Now I can't remember what it was. That happens to me a lot, because I have all these curious ideas, and
Well, you're on Medicare now. that's why.
yeah, that's right. That's part of it. I'm going to blame it on that. I wanted to ask you, Gail, if you recite the times that you're open Monday through Friday as well, for those that might have missed it.
Yeah, the doors open at 7:30 a.m. 8 o'clock is really when we start providing services, and we close at 8 Monday through Thursday. We're only open until 5 on Fridays. We have a great front office staff. Pick up the phone and call us if you have a question, if you're thinking about coming, if you want to know how long you're going to be there, if you want to know, what it may cost if you're going to privately pay. All of those questions can be answered. I want to encourage people to call me. A part of my role at Signature Health is to be a kind of a community liaison. So I get the privilege of representing Signature Health out in the community, visiting different agencies and sitting on a number of different coalitions and teams, and attend a lot of meetings. So I try to make sure that people know what we have to offer, make sure that they're satisfied with the services that they're getting.
Right.
So if you have a question, a concern, a complaint, a suggestion for us, I'm really happy to hear about that. Can I get my cell phone number?
Sure.
Is that the best way to reach me? Is at 440-415-5827. I'm not in the office too awfully much. I'm out and about most of the
Sure.
time, so call my cell. We also have, I should mention, the Consumer Advisory Board.
That's what I was
Madison
just gonna bring up.
is a member of that, and we appreciate his involvement. We really want to provide the best services possible.
Mm-hmm.
And in order to gauge how we're doing, like I said, I try to get out and talk to those referral sources and make sure they're satisfied. But we also want to talk to our patients, our clients, and see if they're satisfied. And so we have a meeting every other month. We serve them a nice lunch, and we just listen. So the ideas they bring to us are wonderful. Many of them have been implemented.
Right.
But any suggestions, people can identify an unmet need. Well, how come you don't have a bereavement group
Mm-hmm.
for people who are grieving? And so we now have a bereavement group.
Wow.
Those kinds of things.
Is there any chance that, like people, if they'd like to look at the facility, they could stop by and look at it, or is that not what you do?
It's tricky.
Well,
It's tricky.
the foyer's open, anybody can walk in the foyer,
Mm.
so that part is open, the part you see here.
I kind of like to see that. That's
And,
pretty
and,
neat.
and the upstairs, if you go upstairs, there's a little bit of area, like a veranda. you
Yeah.
can look. Yeah, that's pretty open to the public, people come in.
Obviously, I wouldn't recognize it as the Ashtabula Hotel anymore.
Actually, you would.
Yeah.
Really?
Because
Historically
it is restored, historically restored.
They kept all the big, wide mop board, baseboards.
Yeah.
You know,
The marble
all the
staircase is still there.
marble
Still there.
staircase, yeah.
The marble.
Do you remember it?
Yeah, the
Yeah.
marble registration desk. That's
Yeah.
our front desk. That's
Okay.
still there. You can see in the photo the 1-inch square mosaic tiles
Yeah.
restored in the lobby area.
Wow.
The rail that went around the mezzanine. Yeah.
Wow.
It's absolutely beautiful.
It
The
is.
offices on the 3rd and 4th floor, the counseling offices, basically are the old hotel rooms.
Is that
The
right?
transom is still there. The dumbwaiter is still on the wall. It's restored.
See, I like that
It's so
historical
beautiful.
stuff.
Beautiful.
Yeah.
Yeah,
Yeah,
it's-
I can
it's
tell by
really
this
beautiful.
picture, it's absolutely.
We say it's a little tricky because it's a medical practice and people have the right to privacy.
Privacy, sure.
And so while we love to show it off, and if you call me, I can maybe arrange a time
Yeah.
when it's less busy, when we can get you through and show you.
I just would
parts
like
of
to see it
Yeah.
myself.
The last time I was there was a dinner with Fred and Linda Bennett.
Oh, yeah,
That was
yeah.
a long time ago.
Yeah. Yeah, I got to tell you folks out there that Gail, I've known Gail for a long time, but I've known her husband longer, and we go back a long, long time. Mike Castrilla, who's been a very good friend of mine for many years. I consider him one of my better friends, and we kind of grew up together, so to speak, in the old days.
Some of it we shouldn't speak of.
Yeah, right, we can't. Well, listen, I think this is a great facility. Is there anything else you want to cover before I let you go?
Did you give your phone number?
Oh,
Renee did not.
No, I didn't think so.
She's keeping it quiet.
440-992-8552.
There it is.
Signature
Do it again,
help.
do it again, Gail.
440-992-8552.
Right.
Okay,
Give us a call.
okay.
Thank you.
Please,
Thank you, Ken.
let's come back again, and there's so much we can talk about, and also maybe you can bring Jonathan with you.
That would
You
be
know,
good.
and I'd really like to meet him.
Yeah.
You would.
We'd enjoy
I'd like
that.
to hear his story as well. Matt, thank you so much.
Yeah.
Always
Thank
you
you.
come up with always a good interview.
I was, I called in and I asked, I said, is it okay? If I line up Gail and,
You got a couple more that you're going to be doing too. That we couldn't do because you had the surgery on your back.
right,
You had a
right.
bad year last year.
Yeah, I had a bad year.
Yeah, but
Made the best of it.
we'll get together on that, and
Right.
we'll set something up. I want to thank you again for coming in. I appreciate it.
Thank you, Pat.